A patient with euphoric mood, decreased need for sleep, hyperactivity, grandiosity, and pressured speech lasting more than 1 week is experiencing an acute manic episode. Bipolar disorder is a recurrent condition that requires maintenance therapy to prevent relapse. Maintenance treatment options include lithium, valproate, lamotrigine, and quetiapine. Valproate is an anticonvulsant with mood-stabilizing properties and is effective for maintenance therapy. Passive-aggressive behavior. A patient agrees to complete medical forms but submits only a signature and says, "I am sure a doctor with your education can take a good history." This is an example of passive-aggressive behavior. It represents indirect expression of anger. Instead of openly expressing frustration, the patient complies superficially but resists completing the task. Other examples include procrastination, forgetfulness, intentional inefficiency, sarcasm, and denial of anger. Defense mechanisms. Immature defense mechanisms include acting out, expressing unacceptable feelings through actions. Denial, refusing to accept reality displacement, transferring emotions to a safer target. Intellectualization, focusing on facts to avoid emotions. Passive aggression, expressing hostility. Indirectly projection, attributing one's own feelings to others. Rationalization, justifying behavior to avoid discomfort. Reaction formation, converting feelings into their opposite. Regression, returning to earlier developmental behavior. Splitting, viewing others as all good or all bad. Mature defense mechanisms include sublimation, channeling impulses into acceptable activities. Suppression, consciously setting aside emotions. Schizophrenia and dopamine. Positive symptoms of schizophrenia, such as hallucinations and delusions, are caused by increased dopamine activity in the mesolimbic pathway. This pathway projects from the ventral tegmental area to the limbic system. Antipsychotic medications act as dopamine antagonists and reduce these symptoms. Dopamine blockade in other pathways explains many side effects. Opioid use disorder treatment. Methadone is used for opioid withdrawal and maintenance therapy. It is a full mu opioid receptor agonist with a long half-life. Its long half-life allows suppression of cravings and withdrawal symptoms and reduces the euphoric effects of other opioids. Adverse effects include QT interval prolongation and respiratory depression. High-functioning autism. A 13-year-old boy with social deficits, lack of friends, restricted interests, and difficulty with reciprocal interaction is consistent with high-functioning autism spectrum disorder. Patients diagnosed later often have normal or near-normal language and intellectual ability. Post-traumatic stress disorder, PTSD, post-traumatic stress disorder. PTSD occurs after exposure to a life-threatening traumatic event. Symptoms include intrusive memories, flashbacks, nightmares, avoidance, emotional detachment, negative mood, sleep disturbance, hypervigilance, and irritability. Duration must be at least 1 month. Acute stress disorder, ASD, acute stress disorder. Symptoms are similar to PTSD but last from 3 days to 1 month after trauma. If symptoms persist beyond 1 month, the diagnosis becomes PTSD. Brief psychotic disorder. This disorder presents with sudden onset of psychotic symptoms such as delusions or hallucinations lasting more than 1 day but less than 1 month. Adjustment disorder. A 61-year-old woman with insomnia, anxiety, and stress after divorce and relocation is most consistent with adjustment disorder. Symptoms occur within 3 months of a stressor and resolve within 6 months after the stressor ends. Symptoms cause distress and impairment but do not meet criteria for another psychiatric disorder. Acute stress disorder requires trauma and lasts up to 1 month. Generalized anxiety disorder requires symptoms lasting more than 6 months. A normal stress response is milder and does not cause significant impairment. DD.